I'm Dr. Nandini Hazarika, Head of Paediatric Oncology and Haematology, and in charge of Neuro-Oncology and soft tissue sarcoma in H.O.P.E Oncology Clinic, Housecas. When we talk of pediatric cancer or childhood cancer, it sounds depressing. But the fact is that almost 70 to 80% of childhood cancers are curable. And when we talk as curable, that means the child gets rid of the disease, then child can go to school, can go to college, work, get married, and finally lead a relatively normal, healthy life. Pediatric cancer is different from adult cancer. First, in terms of the types of disease or types of cancer we see in children, we rarely see in adults. Then the treatment is also different. Like in childhood cancer, the treatment is very intensive, and they are mostly chemotherapy sensitive. That means most of the cancers, childhood cancers, will need chemotherapy as a part of their treatment. And the disease biology, the behavior of the disease is also different in children as compared to adult. And the best part is, majority of the childhood cancers are curable, unlike the adult cancers. What are the common types of cancer in children we see commonly? The most commonest type of cancer in children is the acute lymphoblastic leukemia. It's a type of blood cancer which we commonly call as ALL. The other most common types of cancer in children we see are brain tumors, then lymphomas, the Hodgkin's lymphoma or non-Hodgkin's lymphoma, where the lymph nodes of the body get enlarged. Then there are some abdominal tumors also we see in children, especially in young children, like neuroblastomas, then cancer of the kidney like Wilms tumor, cancer of the liver which is called hepatoblastoma, then the child may get cancer in the eye which is called retinoblastoma, and then bone tumors are also common in children, especially in older children or adolescent children. And there is another type of cancer called soft tissue sarcoma which is also commonly seen in children. The parents should be aware of the symptoms of childhood cancers so that the child gets investigated quickly and we get an early diagnosis. So what are the common symptoms of childhood cancers? See, these symptoms can also happen in other infections as well, in other diseases also. But there are some symptoms which we see if the child is having an underlying cancer. And the symptoms will depend on the type of cancer. Like especially the commonest type, the ALL, the type of blood cancer we see in children, the child might present with a long duration of fever, like fever persisting for 2 to 3 weeks. And we have investigated the child and there's no definite cause is found of the fever, and also the child is having anemia with the fever. The child looks pale, along with there may be some black spots on the body, or there may be bleeding from the gums or nose, there may be associated some swelling in the neck. So this could be a signs of underlying blood cancer. So in case the child is having a persistent fever for more than 2 to 3 weeks and we don't get a definite cause of fever, then the child should be investigated to rule out underlying blood cancer or lymphomas. Then the brain tumor. In the brain tumor, the child may present with a headache or an early morning vomiting associated with headache. Then there may be disturbances in the gait. If the child walks, there may be imbalance while walking. There may be the eye movement can change. There may be slurring of the speech. There may be weakness on one side of the body. So these are the symptoms which can be associated with a child suffering from brain tumors. So these symptoms can happen to any other diseases also, like child suffering from any infections can have fever, can have anemia with enlarged lymph nodes. But if we are not getting any other definite diagnosis, the child should be investigated to rule out underlying malignancy.